you think Obamacare is deeply flawed. So let me ask you, Republicans control the White House, the House, and the Senate. You've had control for 9 months now. If Obamacare is so bad, why hasn't the president introduced an alternative plan yet? He's had 9 months.
Well, there were ideas introduced to address some of the shortcomings of the ACA, but it could not get through the reconciliation process. It was pulled out for a variety of different reasons, and so it never made it to the final law. And the legislation that currently exists does an excellent job dealing with the shortcomings that we felt were important with the Medicaid systems. And it was always envisioned that Congress would eventually get around to dealing with some of the issues that you're raising now around the ACA. But when you're in a shutdown, you prevent that from actually happening, because the people who give technical expertise to the congressmen and senators who've got to actually write the laws, they're not at work anymore.
Republican Congresswoman Marjorie Taylor Greene has sharply criticized Republicans, saying that there is no health care plan. She says that it's time to get one. Do you acknowledge that President Trump does not have a comprehensive health care plan with which to replace Obamacare?
I fully believe the president has a plan. We've been talking about it quite a bit. There's all kinds of ideas. Yes, the issue, Kristen, is which specific parts of the plan do you prioritize? Which are the ones you want to focus on? So as an example, just to talk about Medicaid, because we already did it, what was done with the One Big Beautiful Bill was perhaps the most ambitious reform of our Medicaid system ever. It was a massive effort to realign the president and the leaders of states, governors, so that what the federal government wants to do and what the state government wants to do for our most vulnerable citizens are done in coordination. The president did that with a great passion. He led the way. I spoke to him frequently during that process. We also took out a lot of the fraud and waste and abuse, so it was hurting the system. Kristen, we would have spent $5.4 trillion more on Medicaid if we hadn't addressed that. That would have basically made us a big healthcare system with a small country attached.